Hi, my name is Jay Cahalan, President and CEO of Columbia Memorial. On the occasion of our annual meeting, we want to thank you, our community, for all that you've done to propel us toward fulfilling our vision of becoming the area's healthcare system of choice, the one you choose first for the healthcare needs of your family. We also want to provide you with a review of the past year, as well as a look at what is on the agenda for the coming year. You may have noticed that I referred to Columbia Memorial as a health system. That's because Columbia Memorial has become so much more than a hospital. Our large multi-specialty physician network provides services at numerous locations in Columbia and Greene counties. We have grown to include 30 distinct physician practices, delivering care within a variety of specialties. This year, as in past years, we once again welcome several new physicians who moved to the area to join us at Columbia Memorial, including physician specialists in areas such as critical care, obstetrics and gynecology, spine surgery, and anesthesia, just to name a few. Meanwhile, Columbia Memorial's medical staff has grown to more than 200 physicians, and our large integrated multi-specialty employed physician group model has been singled out as one of the best constructs for delivering care through the era of healthcare reform. While the trend of enjoining physicians and hospitals is starting to gain popularity across New York and the nation, Columbia Memorial has pursued this strategy since the mid-90s and has become one of New York State's best examples of how a community hospital can be transformed into an integrated healthcare system. In order to ensure diagnostic testing support for our multi-specialty physician group, Columbia Memorial owns and operates a number of satellite diagnostic and treatment centers, ensuring that imaging and laboratory services are never far from community residents, and that the continuum of care is maintained through a well-integrated and electronically connected system of services. The bottom line is that this approach is good medicine. Columbia Memorial has been recognized for its innovation and effectiveness around quality enhancements and patient safety. We were the first hospital in New York State to receive National Center of Excellence accreditation in laparoscopic gynecologic surgery, and we are now performing laparoscopic gynecological surgeries at Columbia Memorial that are still not available at most hospitals. As a New York State designated stroke center, we can provide emergency care to those who suffer a stroke, giving stroke victims the best possible chance for full recovery by offering expert and timely interventions. Last year, we opened a new walk-in treatment center, conveniently located at the Ocean State Job Lot Plaza in Valatia. Our rapid care walk-in center is perfect for those minor injuries and illnesses that do not require a trip to the hospital's emergency department. Conveniently located next to our new blood draw center and our Valatia Family Care and Kinderhook medical care practices, the plaza has become Valatia's central location for medical care. These services comprise what we now refer to as the Valatia campus. And just a short drive down the road at the Valatia Medical Arts Center, our Valatia Medical Imaging Service can accomplish advanced CT scanning as well as ultrasound and mammography. Columbia Memorial Cardiology, another Columbia Memorial service, rounds out our medical imaging services by offering echocardiography and nuclear medicine imaging. Speaking of centralized services, the Greene Medical Arts Building in Catskill has long been the primary location for a growing number of Columbia Memorial services. At Greene Medical Arts, patients can access primary care and numerous physician specialty services in one convenient location. Columbia Memorial operates imaging and blood draw services, primary care, and several physician specialty practices. In December of 2012, we purchased the Greene Medical Arts Building, and this year we are undertaking building improvements which will total $2.5 million. We anticipate a completion date of December 2013. Connected to the Greene Medical Arts Building, our 120-bed skilled nursing and rehabilitation center, Catterskill Care, continues to assure that post-surgical patients can access rehabilitation services close to home, and that long-term care residents have a home in their community, close to friends and family. Our neighborhood approach to care means that residents can make their own choices and enjoy the level of independence with which they are comfortable. A 21-unit residential building is a relatively new addition to the property and provides convenient housing literally steps away from key medical services, rounding out Columbia Memorial's Greene campus offerings. To ensure access to healthcare services for those on the mountaintop, We also provide primary care physician offices at locations in Windham and Cairo. And this year, we are opening a new primary care service in Coxsackie. Meanwhile, our information technology professionals are working hard to ensure that these services are connected through an ever-expanding electronic health record. We are proud to provide this integrated health system to the community, and we are pleased to have been recognized for achieving a level of physician and clinical integration which is rare for an independent community hospital. Back in Hudson, on the main campus, we have continued to invest in new technology, make facility improvements, and add new services. In January, we opened the Spine Institute. This new service utilizes innovative therapies and treatments to assist those with back pain and spine problems. Located on the lower level of the Hudson River Bank and Trust Foundation Medical Office Building, the Spine Institute offers advanced imaging technologies and a holistic approach to back pain and back problems. Right next door, our pain management service continues to offer effective interventions for those with acute and chronic pain conditions. Within the hospital, we continue to do all we can to improve patient comfort and provide our first-class staff with the very best facilities to deliver the best care. This March, following extensive renovations, we opened new private patient rooms high atop the hospital's 6th floor. Complete with private bathrooms and showers, these rooms offer a level of quiet and comfort that will help you get well, and offer a view of the Catskill Mountains that will truly lift your spirits. Also on the 6th floor, just on the other side of a temporary construction wall, workers are constructing a mirror image of the same private rooms on the hospital's A wing. This will add 9 more rooms. The project continues to proceed on time with an expected completion date of late summer 2013. Just one floor below, demolition of the hospital's 5th floor memorial wing is progressing. This makes way for an improved and expanded physical space for our behavioral health services and allows for the addition of 4 more patient rooms and newly renovated common space. Over the past year, construction within the hospital was non-stop, and just this past April, a complete renovation of Columbia Memorial's main laboratory was completed. Construction included installation of the latest laboratory equipment and technology. The new space is designed to accommodate the nearly 2 million lab tests Columbia Memorial now performs annually for community residents. With drawing stations in Hudson, Catskill, and Volusia, Columbia Memorial continues to be the laboratory of choice for area residents. An annual report to the community would not be complete without mention of some economic coordinates and statistics. Columbia Memorial's annual budget now stands at $156 million, and the scope and size of our organization has grown to the extent that this year we will pay out $92 million in annual payroll and benefits to more than 1,500 employees, 90% of whom live in Columbia or Greene County. During calendar year 2012, Columbia Memorial served more patients than in any other year in its history. Our outpatient service offerings continued to expand, and this year, that equated to more than 400,000 individual patient visits to Columbia Memorial Physician Services. Despite the economy and several new economic pressures on healthcare organizations, Columbia Memorial was able to invest more than $11 million in property, plant, and equipment. And this year, even after expansion and reinvestment, we were able to finish the calendar year with a bottom line loss of $373,000, or 0.26 of 1%, essentially break even on a budget of $156 million, and indicative of reinvestment of revenues in Columbia Memorial and the community. In calendar year 2012, individual and community contributions, foundation grants, the auxiliary, the second show, and Columbia Memorial fundraising events provided more than $1.5 million to the Columbia Green Hospital Foundation. These funds are used by Columbia Memorial to enhance technology and improve facilities. Other initiatives provide funds for much-needed services like the pediatric dental program and free community health screenings. Our community is extremely generous with their time as well, and this year, community volunteers provided more than 100,000 hours of direct volunteer service. As I mentioned volunteers, I must also note that Columbia Memorial is governed by a volunteer board, the Columbia Memorial Board of Trustees, while the Columbia Green Hospital Foundation Board governs charitable giving and fundraising. Members of both boards generously volunteer their expertise, advocacy, and support, as do countless other individuals and community agencies that assist with our growing network of care. In closing, we thank you, the community, for our many successes. Columbia Memorial is truly a community-based organization, and as always, if you need us, we are here for you 24/7.